My name is Elyse Miller. I am an assistant adjunct professor in the Creative Arts Therapy Counseling program at Hofstra. When students complete the program here at Hofstra, they're eligible for the American Art Therapy Credential Board exam, as well as the New York State licensing exam. When it comes to the exam itself, students have a choice. They can take the ATCB exam, become board certified, as well as New York State certified. New York State will accept the board certification exam as their licensing exam. If they choose to just be in New York State, they can use the BC exam or take the CASL exam, which is a 2-case study that they'll be investigating, writing up. They'll take the test at 2 different times, and they'll have different members of the New York State Office of Professions grading their actual exam itself. So once students are finished here at Hofstra and they complete their degree, they're going to go to the New York State Office of Professions website, fill out certain documents. Form 1, which introduces who they are, do a background check. Then there'll be a form that Hofstra University fills out to show that their education has been complete. Once that is done, they'll be sent a letter by New York State saying they're eligible to sit for either exam, whether it's the New York State CASL exam or the American Art Therapy Credential Board's exam itself. Once they take the exam, that's step 1 for them. However, they do need to complete certain hours. Students are to fill out Form 5, which is a limited permit. They must be working at a facility that is approved by the state, as well as have a supervisor that is approved by the state. Once it's approved, they must accumulate 1,500 hours. 1,000 hours must be patient contact hours. 500 hours are permitted to be documentation hours. While they're completing these hours, they must have 150 hours of supervision. Again, the supervisor must be approved with a letter by New York State. Another credential that the students will be able to sit for or get is the American Art Therapy Credentialing Board to become an art therapist that's registered. That requires 1,000 hours of patient contact hours and 100 hours of supervision. The ATCB would like that the supervision is 50 hours by a credentialed supervisor, so someone that holds the credentials of an ATR-BC as well as an ATCS. That stands for Art Therapist Registered Board Certified, Art Therapist Credentialed Supervisor. The other 50 hours can be supervised someone who is a master's level but must be approved by the American Art Therapy Credential Board. So students, while they're in our 60-credit program, are taking a diverse amount of classes. We teach classes anywhere from ethics to different populations, media, assessment, things that are approved by the American Art Therapy Association. They are, in their first year, assigned a practicum site where they go and start to watch and shadow a licensed credentialed art therapist to get a feel for the program. In their second year, they're then placed in an internship, possibly 2, depending on the site that they go to. They'll need 600 hours in completion before they can graduate. That will prepare them for both practical work as well as factual work, classwork and internship. While they're doing the work, that also helps them prepare for their exam itself. Each class, although we're not teaching to an exam, each curriculum is made based on national standards, state standards, and the practice overall that will help students prepare for their exam itself. The American Art Therapy Credentials Board has an actual study guide that they promote. They do not promote outside resources other than their guide and books they recommend. We do recommend students possibly get a tutor once they complete. There are some facilities that have resources for them, but again, they're not necessarily promoted by the ATCB. The American Art Therapy Credential Board's exam is 200 questions. Out of the 200 questions, 170 questions count. The other questions are test questions, which basically looks at the student's knowledge as well as the schools they're attending, what they're being taught, as well as what they're learning on the field. The test itself is a combination of practical, which means if they've had enough time in the field to take the exam, learned enough while they're in their practicum and their internship, and there's factual questions too. So for example, if you've taken counseling classes, theories classes, applications classes, interview knowledge, things like that, that will be on the exam itself. So it's factual, but yet they'll put it within a practical kind of question. If the students choose to take the New York State CASL exam, that is an exam of 2 case studies. When you go on the New York Office of Professions website under Creative Arts Therapy, you will be able to click a link that says CASL exam. The actual exam is on the website with a list of questions. You have time to prepare both case studies. You will then schedule one test first. When you're taking that test, you have to know the questions as well as your case study by heart. So you should write it, ask for help from possibly a tutor, a professor, a supervisor, and know your case well. Once the case is graded, you'll then know if you've passed or failed that one case. They will allow you to take that case over one more time so you can rework the case. Once you pass the first case, you then do the second case in the same order goes. If you don't pass it, they will allow you to take that test again. The study skills I recommend is making sure they're really paying attention in classes, taking notes, asking as many questions as they possibly can. Again, the test is both practical and factual, so being mindful that you might be someone who's interested in psychology, but there could be questions on special education, there could be questions on medical. When they are studying for the exam, it is helpful to study within a group of 3 to 4 people, each person having a specialty that could help each other out.